Hello, welcome back to the channel. Thank you for joining me on another of my fascinating interviews. Today I'm going to be talking to an ex-holistic dentist. It's not because I desperately need a filling or anything like that, but we all do have these fillings and we all have problems with our teeth. And of course, we've seen problems with GPs, the lack of knowledge really of the human body and the way that GPs have been dealing with big pharma, and we have also seen how big pharma seem to be just happy to take your money and give you any old rubbish. Well, let's find out how that applies to another part of the body, and obviously the mouth. So it's my pleasure to bring in Marina, as I say, an ex-holistic dentist. Hello to you, Marina.
Hi, Richard. How are you?
I'm very well, thank you very much.
Good.
Here, it looks like you're sitting in the sunshine, which is grand. We've got some sun here, which is much needed
At long last.
at long last in the era of global boiling. It's no wildfires here as yet.
No, nor here.
Thank goodness for that. So, holistic dentistry. Could you just explain what a holistic dentist is, as opposed to what I would have ordinary classed a dentist as?
Okay, well, I used to be an ordinary dentist working for the NHS. I suppose I should really go back to how I got into all of this.
Oh, I beg your pardon.
That's okay.
Windows is playing up.
So I qualified in 1986 from the Royal London Hospital and came out, went into general dental practice as a NHS dentist and was putting amalgams in, putting fluoride on people's teeth, because that's what we were taught. And
Yeah.
you go through thinking that you are being taught to do what is best for people. So you don't question it. It's
No.
like vaccines, when you're a medical student, they're always telling you that vaccines are, so why would you go and research it? You just believe all your tutors.
Yes.
So, I never get angry with the doctors that have, taken the jab or pushed it initially. I do now. Because now they should realise. But I think that it's the same with dentistry. We were taught that amalgams were safe. We were
Yes.
taught that fluoride was good for you. So why would you question it? You've got all these wonderful teachers who've, academics. So you just go through life thinking that, or your dental career thinking that that is the way it should be done. And so I had my own, I worked for the NHS, then got my own dental practice. After the birth of my fourth child, she was 3 weeks old. I had a bad car accident and I lost a bit of my finger and thumb of my right hand.
Oh, blimey.
Being a right-handed dentist, that wasn't a very clever thing to do.
No.
I was taken to Addenbrooke's Hospital and they said to me, "You'll never work again." And I thought, yes, I will, because I've got 4 children and I couldn't think that I could lose my career. So I thought, even if I learn to do it with left hand, I will get back to work.
Right.
And so I went on some courses that I would never have done otherwise. And I met some dentists who said to me, "Well, you're not still putting amalgams in, are you?" And I was like, "Why? What's wrong with them?" I remembered my mother, who's German, had told me, "Oh, the German magazines are saying that amalgam's bad for you." And I'd say, "Well, why would they teach us that at dental school?"
Yeah.
So I dismissed it. But these dentists, I went on a course about braces actually, and I never did braces in the practice because I didn't really get it at dental school. I got it enough
Right.
to pass my exam, so I used to refer everybody out. But I went on this course because I'd had this accident and I had to have time off work. And luckily I had a locum in place, so I was able to do all of this. And I sat there for the first 2 days and I was in shock because what they were teaching us about braces was totally different to what I'd learned at dental school, where they were teaching us, if you've got very crowded mouth, take teeth out. Now, the guy that was teaching us from Texas, he was saying, "No, you don't want to do that. You want to make the jaw bigger to fit the teeth in." And he gave us all sorts of reasons why, because it affects your posture, it affects your bite, it affects your vagus nerve. And I just sat there and I thought, oh my gosh, my children are coming up to that age, my older children, where they're going to need braces. And I thought they were going to have teeth out because I'd had teeth taken out.
Yes.
And
So many people did, didn't they?
absolutely, and they still do. And then I realized that it destroys the faces, the facial profile. You have lovely straight teeth, but you have very narrow jaw, which affects your breathing, your posture. And I learned so much that weekend, and it was just completely mind-blowing. And I met some dentists there who started talking about the amalgam. So I then went on some other courses and met Dr. Klinghart, who had just started to come over to the UK then. He was a German doctor, and he was very interested in heavy metals and particularly mercury toxicity. So I went on his courses, and again, it just blew my mind. And I just thought, how can I get back to work? When I do go back to work, how can I get back to work and put amalgams in? How can I send children off to the orthodontist who's going to send them back to me to take the teeth out? I can't do it.
No.
So I went on lots more courses, finally got back to work and decided the only way I could do it was to change my practice, and I'd have to go private because on the NHS I would have had to put amalgams in. So I had to go private so that I could then say, I'm not going to use amalgams anymore. But again, you had to be very careful with the General Dental Council because they say amalgams are safe. And if you say anything on your website to say they're not, they will haul you up before them and have a hearing.
Right.
So I started to learn about mercury toxicity, and I learned how to take them out very carefully. And I opened a practice near Stansted Airport, and I started doing more orthodontics. I went on courses with chiropractors. I did a little bit of nutrition, a bit of homeopathy, and that's how I became a holistic dentist. So a holistic dentist who understands how the teeth and jaws affect the body. And it was a complete eye-opener to me because I had no idea how much of an effect the teeth and jaws have an effect on the body, on your posture. So, if you have someone with a hip problem, it could be due to the bite not being right. You get the bite right, the hip can get better. I had children that came in. I remember one little boy came in, he was 3, he needed grommets, constant ear infections. So I said to his dad, I've just read in an alternative dental magazine, if we build up his baby back teeth with some tooth colour filling material, we can get better drainage, he might not need the grommets. So I gave his dad the papers to read. His dad said, go ahead and do it. Child didn't need grommets.
Wow.
No more ear infections. So I just absolutely loved what I was doing. I'd always wanted to be a doctor, didn't get into medicine. So this was my way of healing people, educating them and healing them. And what I realised was, my children, when they'd all been born, I should have taken them straight down to a cranial osteopath or a craniosacral therapist or a chiropractor, because during the birthing, it can be quite difficult and some of the bones can get stuck together. And so it's a really good idea when you have a baby, take them straight down to someone who knows what they're doing and can very, very gently manipulate the skull, which will then help in the future. It's really important to breastfeed. Breastfeeding, not only for the nutritional side of it, but it teaches the child how to breathe through its nose when it's suckling. And also it has to use a lot of force to get the milk to come out. Whereas in a bottle, they bottle fed and they just suck it up quite easily. Plus, the sucking movement does this and can cause the jaw to become more narrow.
Right.
And that's really important because when you have a narrow jaw, the roof of your mouth is the palate. And if you've got a very narrow jaw, you will have a very high roof of the mouth. If you have a flat palate, then the tongue can sit in there nicely. And the tongue, if it's in the correct position behind the front teeth, when you swallow, then the teeth develop beautifully and you get a better shaped upper arch, which is really important because you get less crowding. But again, tooth development also depends on nutrition. Fat-soluble vitamins, you need the fat-soluble vitamins, vitamins A, vitamin D, and vitamin K2. There was a lot of work done by a dentist in the early 1900s, Weston Price, and he's got the Weston Price Foundation, and he talks about nutrition and how important that is for development of the jaws. And he did a lot of work going around to tribes in Africa, and he was looking at how they all had beautifully developed jaws. And if you think about it, in the 1930s and 40s, all the film stars, Marilyn Monroe, Katharine Hepburn, they all had beautifully straight teeth. They didn't have the orthodontics and the things that we have now. And that was because their diets were better.
Right.
So they had the fat soluble vitamins, which allowed the jaws to develop properly. It's we at dental school, we're not taught any of this. We're just taught how to deal with toothache, gum disease, and do
Again,
some.
it's the same. It seems to be the same old story. It's what's presenting is the problem that you fix rather than the cause and the reason for it. I
Yeah,
read a book. Somebody gave me a book about a year ago now called Breath by an American author, and it's all about breathing and how we should breathe through our nose, not through our mouth.
absolutely.
And he found these old skulls from about 400 years ago, and he says if you look at skulls from 400 years and beyond, they all have straight teeth, and it's only in recent times where we've stopped breathing correctly, and
That's
we
right.
breathe as you say it, and reasons of, as you just talked about with the bottle and things like that, and not breastfeeding and all of that, and how just something so natural, you change a little bit and it has such a detrimental effect on us, and because of that the jaw is smaller, we don't chew
That's right.
solid meats and things
You
like that.
need to do a lot of chewing. You need to have the breathing correct. So I've got a grandson who's going to be 2 next month. And so, I've said to my daughter, he needs to be able to breathe through his nose. And
Yes.
so, when we have a lot of allergies, children that have a lot of allergies, they're like this because they can't breathe through the nose is blocked up. So you
Yeah.
need to find out what the cause is. And the trouble is, we are bombarded constantly with so many toxins in the air, in the food, and that causes allergic responses. And, also when you're breathing through the nose, you've got the little hairs in your nose which filter out the particles, and then you've got nitric oxide at the back that has a bactericidal effect. So by the time it gets into your lungs, it's pretty good. But when you're breathing through your mouth, getting all the
It's straight
particles
in.
in there and the bacteria straight in there, so then it causes problems. And a lot of children sit there watching television with the mouth open. And there is a dentist called Mike Mew. His father was John Mew, who did a lot of work on facial stuff. Getting the facial growth right. Mike Mew's in South London. He's got a few YouTube videos, and he's probably worth watching because he has this exercise called mewing, which is to teach people, children and adults, how to do these exercises so you can change the development of your jaw to make it better. And he's saying things like mouth taping. I've got some here. This is mouth tape. You can put that across the mouth to encourage nasal
Yes, this is.
breathing.
I'm just going to write that down. Sleep strips, it's called,
You
isn't
can
it?
get these from Amazon or probably Boots, but you can, or you can use micropore tape. And
Right.
what Mike says to do with the children is, if they want to watch television or play on their phone, you say yes, but I'm putting a little bit of tape there. But they know they can take it off, and you have to build
Yes,
it up
it's
slowly.
not that thing about like you're being taken hostage and you've got a
No,
massive, great big piece of gaffer tape wrapped round your face and you can't breathe, because obviously,
absolutely.
you know, just for those people who might be a little skeptical on anything, you know how people are.
Yes,
Um,
yes, but it's but you make it you do it with your child so that they you say, right, well, if you're going to watch television for half an hour, put the tape on, and
yes,
also when they're eating, you close your mouth when you eat, sit
because
up straight at the table.
a lot of people breathe through their mouth at night time, don't they?
Yes, and
And
so
the author was saying in this book, I wish I could remember his name, but he was saying to tape it this way, because it's less intrusive at night time. And of course you can brush it aside if you're gasping for air or whatever reason, and you've got to train yourself to continually breathe through your nose, because
absolutely.
if you're just breathing any old stuff in, you don't know what it is. As you say, it's going
No,
straight into the
and
lungs.
the tongue is not sitting in the correct place for your jaw to develop properly. So yeah,
And a
that's
lot of
why.
people have sleep apnea, and
Yes.
he says if you breathe through your nose, sleep apnea is not a thing.
No, and sleep apnea can lead to diabetes, strokes, high blood pressure, cardiovascular disease, and shortening a lifespan. So, we should be aware of all of these things and
Yes,
not just accept them as being normal.
yes. I
Um,
mean, it is amazing how far we have gone with our so-called sophisticated, cultivated world from all these things which are actually A, normal, and B, good for us.
Yes, yes.
It is.
So,
It is surprising.
I'm very much into, I would say to people, if you're going to find a holistic dentist for your children, find someone who understands functional jaw orthopedics, do a lot of research, and start them young so that they don't need teeth taking out. Because every tooth is related to an acupuncture meridian. And so when you take out the 4 premolars, they're related to the spleen. Um, and so people have 4 teeth taken out and they end up with lovely straight teeth. But you look at the profile is dished in.
Right.
And you get a much better facial profile when you make the jaw bigger to fit the teeth in. And it is possible to do it. I did it with a 60-year-old lady. I got her when I was in practice, got her jaw bigger so that her lower jaw could come forward, because when your jaw is trapped far back, you end up with neck problems, you can end up with migraines, you can end up with back problems, hip problems, foot problems, because you're in. The chiropractors say that your hip joints are related to your TMJ, which is here. And also,
right.
if your jaw joints, if you get a clicking jaw, that means there's something wrong with your jaw. If you can't open straight in a straight line up and down, there's a problem with your jaw there. I mean, I don't want to frighten people, because I don't want people to think, oh, go and look at all this stuff and there's a problem here, there, and everywhere. But, just be aware that all these things can affect your general health.
Yes, but making even one small improvement is on a path, isn't it?
Absolutely. And then it brings me on to the amalgam issue. I had a whole load of amalgams, and when I learned about this, had mine taken out. But the problem with that is, you have to do a detox program. You need to see a dentist that knows what they're doing. It can be exceptionally expensive. When I had patients, I had patients that I'd seen for years, and some of them had amalgams, and I never ever said to any of them, you need your amalgams taken out, because it wasn't my right to do that. Plus, a lot of them were quite well, and it's expensive. So if people came to me and said, I want them taken out, I used to get them to sign a paper to say, a disclaimer to say that I couldn't promise they'd feel any better. I had mine taken out, I didn't feel any different. And I used to tell people that, because I'm very much about being honest. And I'd say to them, if you've got a very big one, you've got to be aware that if it's replaced with a white filling, you could end up with the nerve dying, and then you have to decide whether you want to have a root treatment or an extraction. Root treatments are not very good, because they trap lots of bacteria in it, and you can get quite nasty endotoxins leaking out. So you've got that consideration. Then if there's a problem with the bite not being right, that can affect you. It can affect your airway, it can affect your jaw joints. So everything has a consequence. And I do get quite upset when I hear practitioners who are particularly healthcare practitioners, saying to their patients, oh, you won't get well unless you get your amalgams taken out. You're putting that idea into their head that they're never going to get well. So what happens if they can't afford it?
Yeah. It plays on the mind.
Absolutely. So and I would say to people, detox, detox, detox. Find a gentle way to detox. And there are ways of doing it, even if you've got amalgams in place, and get rid of the mercury that way. And I actually personally believe, since the last 3 years, since I found out what works for me, detoxing, I would say I detox every day. I get my children to detox every day, my dogs as well, because we are constantly being bombarded with heavy metals in the air, in the water, glyphosate, even organic food. They spray glyphosate when they've harvested chickpeas. Chickpeas is quite contaminated glyphosate, and oats. And I actually listened to Dr. Tim Spector. I got his book, and I was really shocked when he said even with the organic oats, they spray glyphosate on it when it's been harvested to dry it. Oh. So,
you're under attack, aren't you? You're just
absolutely
under attack. You think, oh, hang on a minute, I found something, some organic oats or chickpeas. I'll be all right with that. And then you learn, actually, in order to mass produce these things, they've taken another shortcut, which
absolutely.
is just defeating the whole process.
And of course, if you have glyphosate, that causes a leaky gut, and then you get problems with your gums. Um,
Right. So what do you do to detox? Just as you've mentioned
I
that.
I use them. I use them drops. Um, I did all the chlorella, I did all the cilantro, everything years ago, but nothing really worked for me. I had an underactive thyroid gland, and um, and then 3 years ago, someone said to me, "Try these drops," and I was like, "No way, I'm not interested," because been there, done it, got the t-shirt, made no difference. But I was nagged into trying them, and within the first week, I started sleeping through the night, which I hadn't done for years, and I was waking every morning with stinky armpits. So I knew that I was detoxing. So I carried on, started to lose weight, get more energy, feel great, and then I realised when I met, or when I spoke to the guy who owns the company, he's still got all his amalgams in place, and he's been doing detoxing for 25 years. He's been in the detox industry for 25 years, and he still had his amalgams in place, and he said he wasn't going to take them out. And I thought about it, and I thought, do you know, my mum, she's 85. She's got a mouthful of amalgams, really big ones. She's got root canals, a couple of root canals, and until she had the intervention, against my advice, her health has been pretty good. She's 85, lives on her own. She's,
Wow. Yeah.
a bit
So
forgetful.
sometimes just disturbing them can be more worrying than actually,
Absolutely.
if they're not causing you any problem, then, and you've had them for, say, 40 years, which is probably the case in my case. When you're about 10, you're visiting the dentist and they're shoving these things in as if they're
Yes.
toffee. And then you think, well, actually, I haven't had any issues with them. So why would you tempt fate in a way with somebody who you may or may not really know if they know how to do it?
Yeah, I mean, even the ones that do know how to do it, they're all, take your amalgams out, get your root fillings out. Then there's something called decavitation, get those out. And I have seen people, I joined a Facebook group, and I had to come off it because I was so upset. There were people there that had seen holistic dentists, had all their amalgams removed, had their root filled teeth pulled out, had their cavitations cleaned out, and they couldn't get out of bed. They were sick,
Oh,
and
gosh.
and they were detoxing, and I was thinking, oh my god, this is just horrendous. And I did get in. There was one guy who got in touch with me, and he even went to Germany to go and see a specialist about the cavitations. And it just occurred to me that sometimes just detox as you're doing it, but find a detox program that's not going to pull out the mercury out the fillings, because some things do pull the mercury out, so you don't want to do that. But you
Mm.
just want something that's going to absorb what is given out when you chew, when you have hot food. A little bit of mercury vapor is given off, so what you want to do is clear that away. If you want to have your amalgams taken out, do, but just be aware of the consequences. No one is going to promise you that you're going to feel better.
Yeah.
um,
It's what's interesting, I think, with this particular moment in time is it's as if we've gone through the last 100 years or so doing an experiment in which we've disbanded nature and the normal way of things and thought that we were much cleverer, more sophisticated. And we've tried this experiment and found actually a lot of it has not been as useful as we thought, these shortcuts to things and this very clever new technology that's come in. I hope that we learn from this, that
so do
actually,
I.
children being born now who are not given so many sweets, I mean, that's one thing, eating better as much as we can within the world that
Yeah,
is sort
yeah.
of poisoning us with everything around us. And then that dentists going forward are not saying put mercury in your mouth.
Yes, but also give. I think what we've done as particularly in the UK, because we've had the NHS, everybody's handed their power over to the doctors and the dentists, and it's NHS this, NHS that. And I learned very early on in my career, I was very for the NHS, but then I realised after a while, there were some patients who just gave their complete power away, and they didn't think it was important for themselves to look after themselves because someone else would do it for them. And
Yes.
that is not a good place to be, because you cannot hand your power over to someone else for your own health. You have to take responsibility for your own health and for your children's health.
Yes, and certainly during the pandemic, we've seen how people just did not do any research and just blindly followed sort of mass guidance, which may or
Yes.
may not have been a sensible thing. There was another point I was going to mention about the lovely. Oh yes, Julia was in hospital fairly recently, just on a scare. We thought it was one thing, and it turned out not to be that at all. But we contacted Dr. Sarah Myhill, who we'd interviewed, just to ask a little bit of advice, and she said in the hospital whilst we were there, just over the phone, ask for a copy of your records as they're doing it, the tests that they've done, because they're your right,
Yes,
because
they
it's
are.
that's your information. And
Yes.
it was very interesting when I went to the ward sister or matron or manager, whoever it was, and said, could we have a copy of these, please? Because before you do anything, we'd just like to be able to review it ourselves or have a second opinion. The attitude that we would even want to have anything to do with it, that they had, hang on a minute, no, these, and we said, and as Dr. Sarah Myhill said, this is your information that you are letting
Right.
them have. It's your information by rights. You should have it immediately. There should be no question. But it's interesting, that attitude, that again, it's like people in authority who are there to serve you seem to think that they're actually there as your masters to tell you what you can have.
Absolutely. Absolutely. It's the same in dentistry. You are allowed to have your records. You're allowed to have your x-rays, or copies of them anyway. So,
Yes, because you're
I,
paying for them, aren't you?
absolutely, absolutely. And I think it's really important that people know how to look after their general health. And we're always taught the things that dentists always say to you: sugar causes tooth decay. Yes, up to a point, but it isn't the only thing. Mostly, it's what's going on in your gut.
Right. Oh,
So,
interesting.
and it's the same with gum disease. Oh, you've got to clean better. Clean, 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 clean. Now, nobody should be using mouthwash long term. It kills off all the bad bacteria, but it also kills off good bacteria. And the problem is, when you start killing off all the really bad bacteria, then some of the ones that are less virulent will start to take over and become quite nasty. You also need to have some plaque on your teeth. That's the other thing they're always saying. Take the plaque off, clean your plaque off, make it sure it's absolutely clean. But the plaque has some good things in it. There's a dentist who recently died, unfortunately, from multiple myeloma, Dr. Al Dannenberg. He's done some brilliant videos about, he used to be a gum specialist, about cleaning the teeth. And he said he's very controversial and he loved it. And what he said made so much sense, that the plaque, when plaque is good, when it's good, but when it's taken over by bad bacteria, that's when it becomes a problem. But you
Right.
need plaque to buffer the saliva to keep it at a certain pH. You need it because it helps get minerals from the saliva to put it in the tooth root. And it also has hydrogen peroxide in it to kill off the bacteria that want to get into the tooth root around the gum area. So you do need to have some plaque there. This is where there's a lot of holistic dentists say, oh, choose xylitol gum. And he says, no, don't, because you're removing all the bacteria and you're removing the plaque, and you want some plaque there. And actually, what he says made sense, because when I healed my gut, this is what made me look at it about 2 years ago. I was very much into you've got to clean everything off, you've got to use floss all the time, you've got to clean after every meal, you've got to make sure every bit of plaque is off your teeth. And I also used to get a bit of bleeding. And even if you get a tiny bit of bleeding, it tells you there's something not right somewhere in your gut or in your body.
Right.
So I then started taking some nutraceuticals, and I suddenly realized my gums were so healthy. They'd never been that healthy before. And yet I'd been slipping with my oral hygiene. So then I started to think, well, there must be some connection between the gut, much more important than we have ever been told, between the gut and the mouth. So I started doing some research and came across Dr. Al Dannenberg. And he's got some brilliant YouTube videos that talk about how it is important to keep some plaque there, and how you don't need to have everything cleaned off by the dentist every few months. You need to take responsibility for yourself and heal your gut. And from what I see, that's absolutely right. I had a little dog with bad breath. And he always had really stinky breath. Yeah, I've got 3 dogs. They all have the same diet, all raw food. And my youngest one always had really stinky breath, and I couldn't work out why. And I don't think it's right to go and be brushing his teeth. He's a dog.
Yes.
So,
Yes,
I'm not
dogs
gonna...
don't normally do that, do they?
Exactly. So I started putting some stuff in his food. Within 2 weeks, his bad breath had gone. And they're all their dogs, all my dogs get everything now, and their gums look really healthy. And mine are really healthy. Mine never bleed. And I don't spend as long as I used to cleaning them. My gums are
No.
lovely and pink and healthy. And so, because you think about it, centuries ago, people didn't clean their teeth. In the jungle, people didn't clean their teeth.
No, they would. I mean, I suppose you wouldn't think. You wouldn't think of it, unless it's been given to you as a concept. You may pick things out that are stuck between your
That's
teeth,
right.
like berries and pips and things. But we don't really have primeval man's toothbrushes.
They didn't have them. They didn't have them, and they didn't have tooth decay, and they didn't have the bone loss that we're getting. When you've got bone loss, there's 2 types of gum disease. So you have gingivitis, which is inflammation of the gum. Then you get, when it becomes really advanced and you start to lose bone, and you start to lose the attachment between the gum of the tooth and the root, that is periodontal disease. Everybody that has periodontal disease will have started with gingivitis, but not everybody who has gingivitis goes on to have periodontal disease. But gum disease is the most prevalent disease in the whole world, in the whole Western world. Right. And that will tell you there's something wrong. And you go and see the dentist, and they say, go to the hygienist, and the hygienist tells you off for not flossing properly and not brushing properly, and says, I'll clean you up, come back in 3 months, and they tell you off because you still didn't do it right. But you've been cleaning, and you're thinking, why have I still got this problem? And it's because it's your gut. So it's telling you there's something going on in your body that probably might not be a problem now, but further down the line, you could end up with a chronic illness. So people need to be aware of what's going on. So that's why I'm saying, go on, listen to Dan Ellenberg. And there's another one, Dr. Stephen Lin, Stephen with a V, Lin. He's got a lot of good YouTube videos with lots of really excellent information about the diet. You must have vitamins A, C, D. K2 is really important. That tells the body where to put the calcium. You want to put it in the teeth and bones. If you just take vitamin D3 without the K2, a lot of my aunt, for instance, had osteoporosis. She was put on calcium tablets, which is really bad, and she was also put on vitamin D3. But studies have shown that if you just have those, you're more likely to get heart disease because the calcium gets put into the blood vessels. So you
milk
need
was supposed to be good for your teeth, wasn't it?
Yeah, the calcium and the vitamin and the fat soluble vitamins in it. But raw milk is obviously the best thing. Raw milk. You've got to, if you want to look after your diet and get a really healthy gut to get healthy teeth and bones, you need to stop eating processed food, stop taking in oils, seed oils, and vegetable oils because they're very inflammatory to the body, and cut down on sugar. There are, I wouldn't have xylitol. I wouldn't have there's some stuff come out recently about erythritol, which a lot of people were using. That I can't remember what the problem is, but I know that there is some problems with that. And all the artificial sweeteners are really bad for you. So, one thing that is good, which Dr. Al Dannenberg told us about, was Manuka honey. Apparently,
yes.
You can brush your teeth with Manuka honey.
Can you?
Yes, and there is research to show it.
That'll please Julia because she loves honey and she loves Manuka honey, although it's not the cheapest of honey, of course.
No, real Manuka honey isn't. But there is research to show it's okay to brush your teeth with it.
It's interesting because people are keen to have very white teeth, aren't they? We've been sold this illusion. I met a gentleman the other day, very nice chap, and I was looking at his teeth because they were so white. I thought, oh, they've got to be dentures then, because they were so clean and so uniform. And of course, the Americans take the mickey out of us Brits because they always say, oh, yeah, your teeth are always crooked and this, that and the other, because we don't go to dentists perhaps as much as they think we ought to. But it struck me how artificial, because all I could see was this flash of perfect white, as if they were white emulsion.
Yeah.
It is an illusion that the teeth are supposed to be that white, isn't it?
Yes. A lot of people are having veneers done. It's where they take off a little bit of the tooth surface. Not all the time, but most of the time they take a little bit of the tooth surface off, and then they make a porcelain veneer that is then stuck onto the front of the teeth, and they can do that to make them straight and white. Yeah, and that's what all the Americans have done.
Right. And is that healthy, or does that not really affect very much?
Well, the problem with that is, I mean, I look at it two ways, because for some people, they get so obsessed with the way they look and they get very stressed about the way they look.
Right. So emotionally,
emotionally, it might be a good thing for them. But as far as having a healthy tooth cut away, that's not great. And then you have the glues, which are not particularly nice. White fillings, there's loads and loads of white fillings on the market. A lot of them have got BPAs in them, which leak out estrogens,
Oh, right.
Bisphenols, like we're worried about plastic bottles leaching estrogenic things into the water. But actually, there's a lot of white fillings that contain those, and the adhesives. And that's the other thing. People are worried about mercury and heavy metals, but look what happens when you have tattoos. There's loads of heavy metals in the tattoos, and particularly titanium. They're finding that in the organs of people who've had tattoos.
So interesting.
There is so much to it. That's why I think we should be detoxing every day, because we are just getting it from everywhere. There's nothing. I came to the conclusion that holistic dentistry was actually a compromise, particularly as far as the fillings are concerned, because if you have your amalgams taken out and the nerve dies, you have a root filling. If you don't have a root filling, you have an extraction that could cause problems with your bite. If you replace it, what are you going to replace it with? Titanium implants. They're very expensive. They act like antennas. I wouldn't have one in my mouth. I'd have maybe a zirconia. In fact, I believe my dad died because he had titanium implants against my advice. He went and had first lot done and then ended up in hospital, and he didn't really need them. Then he went and had the second part done, ended up in hospital, never came out. And
sorry to hear that.
There's a story. There was a story about Dick Van Dyke. I don't know if you remember him. That's for us, our generation. Dick Van Dyke.
Yes. Well, he's still around, isn't he?
Yeah. Well, he apparently he was very ill a few years ago, and they couldn't work out what was wrong with him. Eventually, they realised it was all his titanium implants, and he had to have them all removed.
All right, Mary Poppins.
Yeah. So I think holistic dentistry is a compromise, and I think people need to do a lot of research and spend time getting their guts healthy, getting there and getting rid of toxins.
You mentioned highly processed food, which, of course, in and of itself, food has been turned into a very soft, slushy type of stuff. Whereas if you look back to how we used to eat, we would be eating meat off the bone, really, getting your teeth into it. Like you see lions attacking stuff. I mean, and the jaw is, again, it's that thing. Sometimes the jaw, if you're trying to get something, your teeth is very strong, aren't they? Normally. The jaw is a very strong instrument. And yet, if we're eating very sort of soft food, we're not doing ourselves any favours.
No, and I think, when my daughter first started weaning her baby, I was a bit shocked because she was giving him solid food to chew. But now I've done the research on it, and yes, we should be giving them things to really chew, because they won't choke. Most of the time they won't choke. But, in my head, you've got to give them slop, because that's what I did with my children. Yes. But now I realise that no, that is one good thing that a lot of the mums are learning, is that they do, they give the baby food to put in its mouth that the baby has to chew. But I think they need to be chewing more, and they, as much as people are going into veganism and everything, a lot of the fat soluble vitamins come from eggs, butter, raw butter, raw milk, and organ meat. and my mum used to cook us liver once a week, but nobody does that these days.
No, that's true. Yeah.
And organ meat is very good for the development, and if you're pregnant, I think you should be doing a gentle detox, but also making sure you get the fat soluble vitamins, because while the baby's in utero, the baby teeth are developing already. And then
right.
once the baby's born, the lower first molars start to develop. And there is a pattern where the teeth are developing in the baby, in the jaw. And so about 2 or 3, if you're not giving them a diet with good fats in them, with the fat soluble vitamins, then they might have problems with their jaws not developing properly, and then they get small little jaws. So it's everything. It's nutrition, it's breathing, it's posture, so sit at the table, say to your child, sit at the table, close your mouth when you're eating, sit up nice and straight.
And chewing your food for, that was the other thing.
Yes,
chew for, don't just gulp it. Now, I get accused of eating very fast, and it is true, and I've always done that. And you gulp a whole load of air with it, and it's great lumps. But my granddad used to say I had to chew 71 times or something. I seem to remember.
Yes, but because you need to mix the saliva with it as well, because the saliva has enzyme in it that start the digestive process before it gets to the stomach.
Right. Yeah. So again, there's all these things, and that was the thing. Sit at the table, as you say, sit up straight. All these sort of things that we just think. Yeah. Close your mouth. Yeah.
Yeah. Don't eat with your mouth.
Chew your food. Exactly. Yeah. All these things which make perfect sense and is a holistic process, and yet somehow, over time, we've eroded all of this.
Yes.
And now we're feeling the pain of it.
Yes, we are. And, unfortunately, the new dentists are, a lot of them are interested in implants and cosmetics and facial, injections and things. And I think that's
new technology. It's somewhat sexy, they sort of elevated their position as almost surgeons in a way.
Yes. And I find that compassion is missing. If you have a toothache, we were always taught, someone comes in and they've got a toothache, as long as they haven't got a swollen face, you deal with the toothache, and if it's keeping them awake at night, you open the tooth up, take the nerve out and put a dressing in, and that relieves them of pain. Nowadays you go and they want to give you antibiotics, and then what does the antibiotics take a while to kick in, but not only that, they mess up the bacteria in your gut, mess up the microbiome. So what are we doing to people? And and I think that's not a compassionate way to be. If someone's coming in with a toothache that's kept them awake at night, say, here you are, here's the prescription. If they've got a swollen face, that's different, because you can't make them numb. And that's the other thing I'd like to mention. I'm getting asked a lot by a lot of people about the anaesthetics.
Oh, yes.
With the graphene oxide.
Yes.
I spoke to a friend of mine who's still in practice. He's up north. He's a holistic dentist. He's been one for about 40 years. And he said that, he doesn't really know which ones have got it. And my answer when someone wrote to me and asked me was, well, first of all, I need to have some treatment done, and I am not going to be worried about the anaesthetic, because firstly, I detox, so I know I'm going to get rid of it. Secondly, I'm not going to be living in fear, because people get obsessed with things like this and then they live in fear of it. And the trouble is, if you don't get your tooth seen to, that can cause stress, which the stress hormones aren't good for you. So, you're in a no-win situation. Yeah. So I would say detox and not worry about it. And remember that they are putting graphene oxide in, they're hiding it in loads of things. We don't know where it is.
And so obviously detox. There's an element, is there not, that, the body wants to heal itself.
Yes.
And so sometimes people go at the slightest thing and they don't give the body a chance to do what it might do to get rid of a problem, i.e. by changing their diet. And I'm not suggesting that you don't have a treatment done.
I'm not suggesting that either. But I think the problem is your body has lots of receptors in it, vitamin D receptors and lots of enzymes that need to work with things like magnesium and, calcium. And magnesium, is involved in about 300 different processes in the body. But if all the receptors are all blocked up with toxins, then the magnesium can't get in and do what it's supposed to do. So
Right.
I now believe you've got to eradicate the toxin and then give the body what it needs to heal itself. We don't do healing. Nobody does healing apart from yourself. Your own body will do it if you get rid of the toxins and you give it what it needs. And that means really good nutrition. Sometimes it might mean taking some supplements. But, you know, it's like if you want to have a garden and you've got a garden full of weeds, you wouldn't go planting lots of vegetables in it. You remove the weeds first.
Yes. No,
And
it's
that's the
good
same with your
analogy.
body. That's the
Yeah.
same with your body. Why would you go putting in loads of good stuff if you've got loads of bad stuff blocking up all the receptor sites?
Yeah, so sometimes you may not have to have all these problems with your mouth if you've detoxed and you're eating more sensibly, and all sorts of things improve. Your eyesight probably improves, your
Yeah,
hearing
yeah.
improves. Your ability, your energy levels. There's so much.
And your
Um,
and your brain, the way you might feel happier because
mm,
there's a lot of toxins affect your brain function.
yeah,
So people who are there's a lot of people who are depressed, and a lot of the depression is caused by toxins again.
yeah, and sometimes
Mostly.
that's just showing signals. When there's aches and pains, it's not necessarily, that's the only thing. It's just what is the cause of that, and you get rid of the cause,
Absolutely,
and that's yeah,
absolutely.
absolutely. Well, that's really fascinating. I mean, a lot of people don't, I think, even give their mouths the thought in the way that we've discussed. They just think, oh yeah, toothache, I've got to go down to the
Yeah.
dentist, or I've got to have another clean or another D-plaque. It's become one of those routines like having your car serviced. At the end of the day, we're biological things. We're not mechanical things.
No, and you think about it. Your nutrition goes in that way. You speak, your breathing is all up here. So it's really vital for your whole health because you have three acupuncture meridians run through your jaw joint. You have every tooth is connected to an organ via acupuncture meridians, and then you have the spine. If your jaw joint's not properly, it can make your spine curve. They did some experiments with rats where they got rats and they put them in special boxes. They anesthetized them and put them in boxes so that they could X-ray the spines. Then what they did was adjusted the bites so that the bites were off on one side, and then let the rats run around. And then after a while, I can't remember if it was weeks or months because it's a long time ago since I read the study, they got the rats, anaesthetized them again, put them in these boxes to keep them all sort of still, took x-rays, and 80+% had developed to scoliosis. And then what they did was corrected the bites, and most of them, but not all of them, the spine went straight again.
Wow, it's incredible, isn't it?
So that's how much our teeth affect our bodies.
You wouldn't, you wouldn't think it. You wouldn't think it from the outset, but it all starts. All of these things are it's all little separate puzzles, but they're all part of the
Yeah.
big picture,
Well,
and we do have
that
to.
was that song, wasn't it? The knee bone connected to the thigh bone.
Yeah,
It's all they would. It's all there, but we've forgotten it because people have become so specialised. Dentists specialise in the mouth, then you've got the heart surgeons, you've got the abdominal surgeons, and
yes,
nobody works together. They don't connect it all up as a whole person, and that's what a biological or a holistic dentist is supposed to do.
and I think just to finish up, go back to that point that you made about the fact that we have given away our almost our rights to our own body by letting somebody else tell us about what we should do and
Yeah,
departmentalize our health, and yet we're the ones who are responsible. We do, as you say, we do the healing. We should remember that we are responsible for ourselves,
yeah.
and act as if that's true rather than you just submit, don't you submit to the
Yeah.
doctors and the dentists, and they say, well, I think you should do this, don't you? And you go, oh yeah, okay, I don't know any different.
But people do it to holistic practitioners as well, I'm afraid. We need to be empowering people to take their own health back, look after their own health.
Absolutely. Marina, it's been an absolute joy to talk to you. Thank you so much for sharing
Well, I hope
that
it was all
very
right because
no,
I was very
absolutely it
nervous.
was. No need to be nervous. We're all friends here. I'd be
I know.
fascinated to hear what people's experiences are. I can imagine people will be going, "Oh yeah, I went to the dentist the other day, and they recommend this, that, and the other," and you go, "Oh my goodness." But I think we're in a period of time now where so much of the old ways of doing things, along with new wisdom, is now beginning to come together, and some of the errors that we've made by splitting the body into its compartments is perhaps we're mending that. And I always think of this, and as I mentioned before, it is like an experiment that we start to now go, I don't think that was a good idea, actually, having someone just doing the mouth and someone just doing the heart, and maybe we've got to have a lot more whole body holistic way of
Yes.
looking at things.
Yes.
And so hopefully a new generation of people, assuming we can deal with all the toxins and everything, will be much healthier in the future because they will have learnt from these errors.
I hope so. I hope so. Well, I certainly, my children certainly take on board what I say.
Yeah, no, good for them.
Yeah, and my grandson. So that's lovely. But if
Yes.
anybody wants to email me and ask me any questions, I cannot give dental advice. I'm not allowed to because, but I can point people in the right direction and perhaps tell them where to look. But I
Okay.
cannot give any
No.
dental advice.
So would you like me to give your email address, or do you have a web page or something?
No, I am going to get a website because there's so much I want to be able to tell people, but I
Yes.
haven't got it organised at the moment because I've got a lot
Right.
going on in my life. So
Okay. Well, I tell you, I mean, what I can do then is when
I
you've
can give
got
you my
something.
email.
Yeah. Okay. That'll be
I'll give you
fine.
my email, and then you can put that perhaps underneath. And people, feel free to email me. I can do general advice, and you can ask me about a problem, but I cannot give you direct dental advice.
Absolutely. Yeah. No. And sometimes when you do all this sort of stuff, you get swamped, as I know, and you can't always answer all the emails. And I just say to my viewers, they're constantly emailing me, and then sometimes they'll say, "Oh, I haven't had a reply from you," and life is just sometimes too busy to spend all
Yeah.
day answering emails. Just to put that caveat out there. So, if it's an unsolicited email, you may or may not get a reply. I do try and
Yeah,
like the rest
I
with
will
yourself.
try because I want people to educate themselves, and if I can point them in the right direction, then I'm very happy to do that.
Brilliant. Well, there we go. So, ladies and gentlemen, things you didn't expect to hear, perhaps from the channel, all that holistic stuff about your teeth and your health connected to dentistry. But I think it's been absolutely fantastic. Marina, brilliant to talk to you.
Thank you.
I hope everybody out there got something. I'll be back
Hope
again
so.
with more. I'm sure they did. I'll be back with more interviews and bits and bobs in the future. But for now, from Marina and I, if I can find the off button, thank you for joining me, and we'll see you next time.
Bye.
Bye-bye.